Hello, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Here we are at our North Wales location and about ready to go over video 2 of the low back pain course on how you can tell and differentiate which type of low back pain you have or what applies to you. You are here because you found us online, you saw a brochure, somebody forwarded you video 1, but either way, thank you for listening and coming to our second course, and thank you for taking the time to do so, and congratulations on taking that step to find out what's going on. Figuring out what's going on is half the battle. So once we determine a cause, you know, that in and of itself will help you differentiate what to do. So we're going to go through a few things today that you're going to be able to do at home to see, you know, is it a disc problem, is it a muscle problem, is it an SI joint problem? One of the things that you have to realize that even before we get into all of this is that you may not fit into one of these categories perfectly. So you may get a little bit of a positive sign in the disc category. You may get a positive sign in the SI category. You may get a positive sign in the muscle category. And one of the things that I have found, especially with my younger therapists who are going through training and are still in school, if you look for something, you're going to find it. So what that means is if you really are bent on the fact that you have a disc problem, and this is all disc, and you can kind of trick your mind into saying, yeah, you know what, I think that test was positive. I think I have a disc problem. Really know whether you get a positive or a negative. So when you have a positive for these tests, it's going to light up, all right? It's not going to be a, well, I think I kind of feel something's there, maybe, sort of. No, you're going to know right away, this symptom got relieved, this symptom got worse, this leg is longer. So, don't go looking for things that aren't there. But at the same time, if all of these different things that we show you to do, you're like, that's me, that's me, that's me, oh my gosh, I'm completely messed up. First of all, not the case. But second of all, know that that's very common. It's very common when people come in for them to fit into several different categories. I can't tell you the last patient that walked in here and was a clear-cut disc problem, and all we did was a bunch of disc exercises and they were fine. Most people that we see are very complicated, have a lot going on. We're looking at hips, we're looking at knees, we're looking at the back just to figure out everything that's going on, because a lot of people have been dealing with this for a few months, years, in some cases. So it's not uncommon for people to have several different things in these categories. So don't be alarmed if you are getting positives in all these categories. So the first thing we're going to do is we're going to do what we call a slump test. And what this is going to do is this is going to check for a disc problem. All right, so what you're going to do is you're going to slump down. Okay, literally just sit in your chair or on a table and slump down and then straighten your leg out. Now you might feel some tension behind your knee, you might feel some tension in your knee. That's perfectly normal. If you can't get your leg all the way straight, that's okay too. All right, now I'm demonstrating these myself because I want to show you how easy it is for you to do them at home. All right, so I know that my voice is going to go a little in and out now, but I didn't want anybody here next to me, so you weren't sure on how easy these were to do at home. These are very simple for you to administer by yourself at home. So what you want to do then is you're going to slump down, drop your head, leg comes forward. Now you may feel some tension going down your leg. You may feel like almost a pull down your spine. You may feel numbness, you may feel something with this. You may feel nothing. You may be in this position and feel nothing. Now what you want to do is you want to lift your head up and look at the ceiling. If that relieves anything that you were feeling, all right, that's a positive sign. Okay, that's a positive sign. There's a sign that there's possibly a disc issue going on that could be causing some of your pain. All right, so again, slump down, leg out, look up, see if there's a change in symptoms. For me, I have nothing. I have nothing here, I have nothing here. I have no disc involvement. I will tell you I have an MRI that says I have multiple herniated discs. All right, so don't be alarmed if you are expecting a positive sign or you're expecting some relief or you're expecting something on the disc test and nothing comes up because somebody told you along the line you have herniated discs. I have 4, all right, but I can do this test totally fine, all right? So nothing happens. If you're in this position and you're like, I kind of feel something, maybe, I don't know, maybe there's something, that's a no. You don't feel anything, okay? When you feel something or something goes on stretch and you have relief or you get, irritation or whatever, you're going to feel it. You're going to go, oh my gosh, that's it. Oh my gosh, I can't even, lift my leg up beyond here. Like everything goes on slack. You're putting pressure on your disc in this position, so it's going to light up. Don't split hairs. If you don't feel it, you don't feel it. It's a good thing that you don't feel it, It doesn't mean that you don't have back pain. It doesn't mean that there's not something going on. That's just not one of the issues that you have. So the second thing is we're going to look at heel and toe walking. And it's exactly as it sounds. So you want to walk on your toes, okay? So just like this, and you're just going to walk and stay on your toes. All right, now I'm just walking a short distance to stay in the camera. All right, but you can walk 5 feet. All right, what you're going to look for is as you take that step forward, do you drop? Can you not handle it? Is there an asymmetry between your feet? Okay, same thing with heel walking. You're going to walk on your heels. Go walk on your heels for 5 feet. Is there an asymmetry? Do you drop your foot? Can you not maintain that foot being off the ground? Now, if you can't maintain balance, that's not a positive test. Walking on your heels is a little bit difficult if you don't practice it. So don't worry if you can't maintain your balance. That's normal. But what's not normal is taking a step and having your foot flop right away. That's not okay. That's another indication of something going on at the nerve level, that's something going on that's affecting the nerve, which is the disc, most oftenly. So, those are kind of some red flags that say, hey, we got some issues here. Those, while it may not be totally your disc causing a positive test, what you want to be aware of is if you test positive for any of those 3 tests, you have an issue. All right, this is not something to be ignored. There's something going on. So if you're splitting hairs and saying maybe there's not anything going on or this is something that, runs in my family, no, that's a problem, okay? So just kind of know that. And again, don't split hairs. Walk up and back a couple times on your heels. Walk up and back a couple times on your toes. You'll notice right away if you are not able to, maintain the same step on each side. So now we're going to talk a little bit about the SI joint. So the SI joint, as we went through, is that usually that pain where you're like, I got pain right there. And it's not the pain that, people will say, like, I literally have a pain in my butt. This one is like, it's right there, like right there. That's an SI joint problem. So what you can do at home, and this is a little bit trickier to do by yourself, but it's still doable. You're going to check your leg length. And some people already know they have a leg length discrepancy. So for you, this test is null and void. If you have a lift in your shoe or know that you've had surgery and one leg has come out shorter than the other, this test is going to be positive for you. You don't even have to bother doing it. Now, someone along the road said an off-comment statement like, oh, I think you might have a leg length discrepancy, whatever. This is for you. So what you're going to do is you're just going to lay back. You're just going to push your butt off the table and back down and then straighten your legs out. Now, what you want to do is you want to look to see, and you don't want to sit up. All right, I'm sitting up just to talk to you. But as you're laying down, you want to put your feet together, okay? See where the bones of your ankle are. All right, so it's kind of the best way to do it. So you take these bones here on the inside, and you're going to see where they line up. Do they line up together? Is one below the other? Again, don't split hairs. If you're like, I think, kind of, maybe, no, okay? One will be here, and one will be down there, okay, if there's a true leg length discrepancy. Now, to make this easy, just have somebody look as you're laying there, is one higher than the other? Is one lower than the other? quickest way to kind of see if there's an SI joint problem going on. Usually I tell people try and grab somebody who's around. It's a 2-second test just to see if those bones are lined up. And again, don't split hairs. If it doesn't look like, if it's not obvious, it's not there. You can find a problem if you really want to find a problem. You can self-diagnose incorrectly if you force it. Don't force it. Again, nobody's not believing you own back pain, may not be your SI. So now what we're going to do is we're going to talk the muscle pain, the muscle diagnosis. So this is a little bit tougher to do on your own, but what you want to do is literally take your knuckle and push on your back and go all the way down into your butt. And I want you to push really hard, all right? This is not a gentle rub. Like, you should feel yourself in there, okay? Now, you will most often, if you are experiencing back pain, you're going to feel spots where you're like, it feels like I have my knuckle on my back. And then you're going to feel like, ow. And then you're going to go down and you're going to feel another ow. If you are truly pushing hard, that's indication of muscle, okay? There's muscle issues going on. And yes, I know people always say to me, well, if I push with my knuckles in any part of my body, it's going to hurt. It's not true. If you push with your knuckles into a healthy tissue, it should just feel like pressure, like somebody's pushing on your, but it's not pain. It's not a, oh, that hurts kind of feeling. It should just, I don't know if it feels good. I mean, some people say it feels good, but it really should feel like nothing. It should feel like you're kneading dough. So if you push on something hard and you get a positive reaction, meaning it hurts, you know, or you feel like when you go to the right and you push over there, that doesn't hurt. But when you push to the left, that really hurts. That's a positive reaction. If you go into spasm, meaning like all of a sudden you're sitting at your desk and you can't get up, or you can't get out of bed one morning because you're so stiff, those are all muscle reactions. Those are all positive muscle reactions. You know, you need to take a warm shower in the morning to loosen up. Heat helps muscle. It doesn't help disc. It doesn't help anything else. So those are all positive signs of muscle involvement. All right. So again, you know, don't split hairs, you know, but at the same time, don't think that, oh, well, you know, I'm pushing really hard. This would hurt even if I didn't have back pain. It's not. It's not going to hurt. If I can sit here all day and do this into my quad and not feel anything, you know, but there are certain spots on my back that I can hit and I'm like, I got it. That really hurts. So those are just a few ways that you can look and see what your problem is at home. If you have a problem, see where you fit into. And again, those are not all the categories that there are of low back pain. Those are just a very few snippets of what can go on with back pain. So, you know, have a look. You know, if you want, you can certainly take the free phone consult that we offer in order to talk to one of our therapists that specialize in back pain and sciatica and tell them what's going on. And you can take part in that, and you can look at the link on the website or on the email that you got to do that. You can reply to this email, let us know what's going on. But if you think there's something going on, you think it's something serious, don't wait, don't hesitate. It only is going to get worse, it's not going to get better. So next video, we're going to go over some things that you can do at home to correct some of these things. Thank you.